Do you or someone you know have diabetes? Have you recently been diagnosed with diabetes? What is diabetes? What are the symptoms of diabetes? And who is at risk for developing diabetes? Well, if you guys want to learn all of that, make sure you're tuning into this video all the way to the end because I am going to discuss all of that in today's video. So guys, my name is Bytyqi. Welcome to the Voice of Diabetes. I hope you guys are enjoying my channel. And if you are, please don't forget to subscribe, like this video, and also share it with other family and friends, and comment below. What is diabetes? Diabetes is a disease that occurs when blood glucose, or also called blood sugar, is too high in our bloodstream. Blood glucose is actually the main source of energy from the foods that you eat. So whenever we eat food, a lot of that turns into glucose or blood sugar, and then our body takes it and puts it inside the cell where we use it for energy. How does it get inside the cell? That's a very good question. So we have something called insulin, which is actually produced by your pancreas, and that insulin goes in, opens up the cell, and allows the glucose to get in, and therefore we can use it for energy and go about our days. However, when we have diabetes, unfortunately, there are different types of diabetes, but when we have diabetes, we're either not producing enough insulin, so our pancreas for some reason is just not giving us enough insulin, enough of those keys, or we are making insulin, but our body is resistant to it. What do you mean resistant to it? Well, stay tuned because I'm going to talk about that in just a minute. Before I do that though, I do want to talk about type 1 diabetes before we move into type 2. Type 1 diabetes is usually diagnosed in early childhood or even in the adolescent age group. Sometimes you might even hear the term used, juvenile diabetes. They use that because it's diagnosed earlier in life. Type 1 diabetes, the pancreas for some reason does not make any insulin at all, and patients with type 1 diabetes require insulin for the rest of their life. To this day, we do not have a cure for type 1 diabetes. However, the good news is now we have a lot new modern technology such as insulin pumps and sensors that make treatment of type 1 diabetes much easier, thankfully, and we're working on even more and more each day. Although we're not really sure why type 1 diabetes occurs, and we're not really sure why the autoimmune diseases occur either, and why the body all of a sudden attacks its own body cells. However, we do believe that type 1 is caused by genes and environmental factors such as viruses that might trigger the disease. So that's kind of the idea that we have. And just remember, these patients who have type 1 require insulin lifelong, and they need insulin every day for survival. Type 2 diabetes is a little bit different. So type 2 diabetes is caused by several different factors, and including lifestyle and also genes. So we know that family genetics play a big part in the diabetes world. Obviously, having a family history of type 2 diabetes puts you at higher risk, age puts you at higher risk, but also being physically inactive, being overweight or obese also puts us at higher risk. Extra weight sometimes causes insulin resistance, and it's common with type 2 diabetes. And we know that the location of body fat makes a big difference, guys. Extra belly fat, so weight around the central area, is linked to insulin resistance, type 2 diabetes, heart disease, and much more. So you're probably wondering, well, what is Diana talking about? What does insulin resistance mean? And that's actually a very good question. So whenever we have extra weight, or we are overweight or obese, as I mentioned earlier, what happens is our body requires more insulin to do the same amount of job. So initially what happens is your body, your pancreas, notices that the blood sugar levels are starting to rise because we're eating more and we're packing on more fat, more weight. The pancreas will start to compensate and starts to work a little bit harder and says, okay, I can try to make up for what's going on here. So that's what happens usually in pre-diabetes. It's the sugars are higher, but they're not high enough to be diagnosed with diabetes because the pancreas is still really working. Eventually, the pancreas takes a back seat and says, you know what, forget it. I'm only making X amount of insulin, and you're on your own for the rest. People who continue to obviously lead that kind of lifestyle where they're not exercising enough and their weight is still above target or optimal ranges, then they start to build higher blood sugar levels in their bloodstream because now the pancreas is no longer able to compensate for what's happening. So as a result, we build insulin resistance, and we're not making enough insulin as well either. So the combination of two leads those people to develop type 2 diabetes. Insulin resistance, a little bit more simplified for you, I like to think of a door. So there's a door, and eventually if we start to pack things in front of the door, like we're starting to put bricks in front of that door, it's harder for you to open the door. Therefore, it makes it much more difficult for things to get in and out. As insulin resistance is very similar to that. The more weight we pack on and the less active we are, we're not using that glucose for energy, we're kind of just letting it sit around, we're not burning it the way that we should. What happens is eventually we tend to build insulin resistance where insulin cannot enter the cell, the cells become less receptive, just like that door with bricks in front of it becomes less receptive for you to open it more freely. It's the same thing that's happening inside the cell. So therefore it becomes more resistant and we develop very high blood sugar levels. Now that I have simplified what diabetes kind of is and why we go on to develop diabetes, you're probably wondering, well, what's the big deal if I have diabetes? Why is this a problem? This is a problem because blood glucose is meant to enter the cell and we're meant to use it for energy. Just like when we fill up our cars with gas, we drive and we burn that fuel, and obviously we're requiring more and more fuel as we go on from point A to point B. Well, when we're not using that fuel or that glucose, what happens is if it's just sitting around in our bloodstream, it starts to cause a lot of problems internally. So over time, high blood glucose leads to problems such as heart disease, stroke, kidney disease, eye problems such as blurry vision and blindness, dental disease, nerve damage, and foot problems. So diabetes honestly affects every single part of your body, including mental health, because we know that diabetics tend to be increased risk for anxiety and depression. But additionally, obviously, it affects the heart, the kidneys. I am sure that if you are a diabetic or you know someone with diabetes, you might know that several people who go on to develop, either amputations, they're blind, they can't feel anything in their feet, they have numbness, tingling, making it very hard to drive, making it very hard to walk, and they have unsteady gait because they can't feel the ground that they're walking on. So guys, it really is a big, diabetes can really cause a lot of problems, which is why we really want to be cautious. If you are a type 2 diabetic, being more active, changing your diet, and all of those can make a big difference. So now that we talked about the possible complications, you're probably wondering, well, what are the symptoms of diabetes? How do I know if I potentially have it? So sometimes actually diabetics will be diagnosed on routine blood work. They'll go in for a physical exam, and then they'll recognize that their hemoglobin A1C, which is the average for the blood sugars for the past 3 months, will be elevated. And if you want to learn more about the A1C, check out my video that I have linked up above, and that kind of explains what an A1C is. But in other words, most of the time patients will actually be very symptomatic. Some of the symptoms that you may experience will be increased thirst or urination, increased hunger, fatigue, tired, blurred vision, numbness or tingling in the feet or hands, sores that do not heal, and unexplained weight loss. So you're probably wondering, well, what do you mean weight loss? I thought diabetics gain weight and they're overweight or obese. Actually, what happens when our blood sugar levels are too high is, remember, the glucose is not able to enter the cell because there's not enough of those keys, or your body is just very resistant and the glucose has a hard time getting in and out of the cell. So what happens is your body has increased thirst and urination because your body is actually very smart and it's trying to work to get rid of this extra sugar. As a result, you're drinking a lot of water and you're urinating, trying to get rid of the sugar that's in the bloodstream. And then you're also very hungry because the cells are not getting fed. They're starving because there's nothing entering and there's not enough fuel entering the cell. So as a result, you're always eating, but you're losing weight because you're actually starving your cells. So although you're eating more, you're losing weight because of that explanation I just made. Your cells are actually starving internally. They're not getting any food, any fuel sources. So as a result, you're seeing a lot of weight loss. And then we know, obviously, high blood sugar levels affects the pressures in your eyes and can cause a lot of swelling. As a result, patients have significant blurry vision. Now they're using cheater glasses. Now they're, everything is changing, but they're not sure. Sometimes people relate it to age. They're not really sure what's going on. But a lot of time when your vision becomes blurry all of a sudden, that's a concern, and you definitely want to reach out to your doctor and ask more information about that. So then numbness and tingling, because we know that affects, high blood sugars affect the nerves. So as a result, patients are starting to notice that they're feeling very tingly and they have, a lot of numbness going on. And then of course, a lot of patients that we diagnose in the hospital, you actually come in, they have sores that just won't heal. Maybe they failed oral antibiotics and now they're coming in with fever, chills, because the sore is getting worse and it's not responding to oral antibiotics. And that's because we know the high blood sugars make healing very difficult. So diabetics have a difficult time healing, but let alone when sugars are out of control, it almost makes it impossible to heal. So a lot of times patients will go in and then they'll get diagnosed at the hospital. Once we check the blood sugar level, it might be in the 600, 500s, whatever the case may be. And we say, hey, now we know what the source is for this non-healing ulcer or cyst or whatever it may be, and that's because your sugars are running so high. I hope you guys enjoyed my video, and please support my channel and subscribe, and comment below. Let me know how you were diagnosed and your story and how you learned you became a diabetic, if you are a diabetic or a pre-diabetic. So I'll see you guys all next time. Take care.